Hello, good afternoon, and welcome to Niger Delta Today. This is a Friday edition of the program where we serve you all activities that are relevant to the Niger Delta region and, of course, how to move the course of the region forward. We shed light today on an important public health concern that has been quietly making the rounds, which is, of course, Mpox. Once known as Monkeypox, this viral disease has re-emerged in parts of Africa, including Nigeria, raising questions about awareness, prevention, and the region's readiness to respond. We'll unpack the science, the risks, and the realities for our Niger Delta communities, where public health challenges are often layered over other pressing concerns. So stay tuned. You might find that knowing the facts could make all the difference. Well, today is all charged with health concerns. We'll also explore and examine a subject that often hides in plain sight, which is, of course, health insurance and the broader question of health security in the Niger Delta. We'll look at why universal coverage is still far from reality and how communities are coping with gaps in the system. Of course, what reforms could truly safeguard lives. So stay tuned as our guests today bring both policy insights and grassroots perspective. I'm not doing this alone. My co-host, Sifan O'Day, is right here. Sifan, good afternoon.
Good afternoon,
and
Xavier.
Happy Friday.
Yeah, thank God it's Friday.
Yes.
And you're looking Niger Delta.
Thank you very much.
So kick starts with the story of interest.
Indeed.
Well, the National Association of University Students, NOAS, has lamented the unacceptable late-night conduct of computer-based CBT in University of Umoh, highlighting the security implications and its perceived the poor concern shown by the school over students' welfare. A release signed by the chairperson of NOAS, Comrade Nene Sien, and Secretary NOAS, Comrade Odudu Abasi Sunday, is requesting that the practice be discontinued immediately. The release also added that NOAS will be dispatching a fact-finding team to ascertain the full situation on the ground, which includes allegations of students encountering attacks on their way back from the late-night test, as well as those suffocating and fainting due to the crowd at the CBT centers. There are also allegations of limited computers of about 1,000 provided to cater for a student population of over 30,000. Well, Xavier, 1,000 computer to cater for 30,000 students. That's a huge gap there.
Well, when the announcement about CBT commencement in University of Umoh came, it was accepted as a welcome development, especially looking at moving on with the times and the changing trends and the educational provisions globally. But then the question of effective preparation comes up because, I mean, to begin that kind of project, you must have put in place the modus operandi and the things that would help you actualize the goal of a CBT based examination. So University of Umoh and the many complaints that have been emerging recently, talking about students who have to deal with the enormous crowd during examination because they don't have access to sufficient computers to cater for the examination, raises a lot of concerns, and the students have been lamenting. We see on social media different footages showing students encountering these issues, and it's as if the school authority is not really proactive or responding to the issues. And we're even supposed to speak to a group of students today on the story of interest segment, but then it's as if they're having challenges with speaking up because they feel maybe they could be victimized. And when students are not free to speak up, you begin to wonder if there are issues we need to be worried about. The
I would have said probably we should review the exercise, but then if you look at it with people fainting, I think they should put a stop to it for now until the adequate provisions put in place to ensure that this thing is done properly, because you can see the way, I don't know whether it's a girl or boy being carried out there, and it's
that is the call that has been at the front burner ever since the CBT examination started and was introduced. But then it's as if the calls are not hackened onto, but that will continue to see how we can, reach the school authority and get them to respond to the needs of the students, and perhaps look at how to review the CBT and sort of create that enabling environment for students to be able to write these examinations without running into health challenges. Already there are allegations that there are students who run into a really dire situation when returning from these late night examinations that run into 10 p.m. Can you imagine that?
10 p.m. Why right up to that time?
And when you look at the location of the University of Uyoh permanent site, you begin to wonder how a student, maybe a female student.
Is there any provision for vehicles to convey them from the permanent site back to the main campus for those staying there? So all these are things that should be put in place before we carry out it. It's actually a good idea, but then how prepared are we? Are we ready for this process?
All right, well, we'll continue to look at these issues and bring you updates regarding what steps or moves the government or the school would be willing to take towards ensuring that these issues at the front burner are laid to rest and students are able to write the examinations in a serene environment. Well, let's bring you Niger Delta updates for today. Ahead of the commencement of the online voter registration on August 18, the Independent National Electoral Commission, INEC, in Akwa Ibom State has clarified that the exercise is intended for aspiring voters who were previously ineligible to register. The State Resident Electoral Commissioner, Mr. Umoh made this known during a sensitization visit by the Akwa Ibom State Directorate of the National Orientation Agency, NOA. Mr. Ifanga assured residents that the process will be seamless, noting that the verification system in place makes it impossible for voter cards to be cloned, purchased. Earlier, the Akwa Ibom State Director of the National Orientation Agency, Mr. Mpox, described the visit as strategic, aimed at ensuring the success of the continuous voter registration exercise.
So the people we are actually targeting are people who couldn't, for any reason, register from that time to date, and especially the people who weren't qualified before now, but are now qualified to register. And these are people who have turned 18 since the last time we did the registration. And of course, it is open only to Nigerian citizens. And we've made room for ease of registration. You can come with the national ID card as a means of identifying yourself that you are the person whose name is on the voters register, and then they call up your information and you can vote. So the point is, picking people's cards, buying the cards off them will not give you any advantage. It may give a disadvantage to the voter who may not be able to go to vote.
Meanwhile, the Akwa Ibom State Police Command has successfully recovered another vehicle linked to a stolen car syndicate and arrested an additional suspect. The police action led to the arrest of Otobasi Georgime, a male suspect found in possession of a Toyota Camry with registration number BGM 934DA. This vehicle has been confirmed as one of the stolen cars connected to the previously apprehended syndicate. A release signed by Police Public Relations Officer, Akwa Ibom State Police Command DSP Tim Von John, noted that the command is intensifying its efforts to recover the remaining stolen vehicles, reaffirming commitment to ensuring the safety of lives and property.
In the meantime, the Bayelsa State Police Command has promoted 48 officers from the rank of Inspector to Assistant Superintendent of Police, ASP. Decorating the officers of the police officers' mass in Yanagwa, the Commissioner of Police, Francis Idu, who was represented by the Deputy Commissioner of Police in charge of operations, DCP Musa Mohammed, charged the newly promoted officers to see their elevation as a call to more responsibilities in crime detection. The promoted officers pledged to redouble efforts in crime fighting in Bayelsa State.
activities that is routinely taking place in the Nigeria police, because the Inspector General of Police has concern about the welfare of his personnel. And elevation, promotion is part of welfare package that can ginger the morale of personnel. Today you have witnessed elevation of some inspectors of police that has been graciously elevated from the rank of inspectors to the rank cadre of our superintendent of police. They are being elevated as assistant superintendent of police. And this means, one, more responsibility on them. As you have heard earlier, I have charged them to be more responsive, more disciplined, and to be sure on any act they will do in the course of their professional duties. Not only in the course of their professional duties, even in their personal life, private life. It is expected that they will show more and higher morality and discipline.
The federal government has commissioned 4 new water projects in Ogoniland, reaffirming its commitment to the United Nations Environment Programme's UNEP recommendations. The new facilities located in Bodo, Ukwere, Boa, Taba, and Etio communities across Kogana, Kana, and Elemi local government areas, Rivers State, were unveiled by the Minister of Environment, Alhaji Balarabe Abbas, and Chairman of the Hydrocarbon Pollution Remediation Project, HYPREP, Governing Council, Professor Nenani Barini Zabe. The project coordinator, Professor Neni Barini Zabe, linked the Prota projects to President Bola Tinubu's renewed hope agenda, highlighting a surge in community acceptance and confidence in IPREP's work. Let's take a look.
We are advancing soil remediation in impacted sites, restoring farmlands and ecosystems that once sustained generations of Ugoni families. As of today, the ongoing Phase 1 shoreline cleanup and mangrove restoration projects are 57.7% and 93% complete, respectively. It is essential to emphasize that our multi-species mangrove restoration efforts are economically sound and will promote biodiversity recovery and fisheries enhancement.
Once again, I extend the appreciation of the President to the Ogoni people. He's very much keen in trying to make sure that we address all the problems of Ogoni. The Ogoni have suffered for too long, so it is the duty of the federal government and all agencies that are relevant to see that we address the worries of Ogoni people and all those that have been affected by pollution in any other thought. And we also must comment on the Ogoni for their resilience and its strength.
Thank you for staying tuned. Our first conversation zeroes in on Mpox, a disease that many are still confused with outdated or incomplete information. With recent confirmed cases reported in some Nigerian states and the World Health Organization updating global alerts, it's important to ask, what do people in the Niger Delta really know about Mpox, and how ready are our systems to detect, treat, and contain it? Our guest today brings insight into both the medical science and community health realities. So let's get straight into it as we introduce State Immunization Officer, Akwa Ibom State Primary Healthcare Development Agency, Dr. David Umoh. He joins us live. You're welcome on the program. Thank you for joining us.
Thank you for having me.
Thank you for joining us, Dr. David.
Good afternoon, viewers as well.
Well, when we talk about understanding Mpox from the context of how why it is important and the health emergency that it breeds for the Niger Delta region, considering how unique the region we are operating from is, what would you tell us about the issue of awareness of Mpox, and why is it critical that this particular issue be taken seriously?
All right, thank you for the question. Mpox is a viral infection that's caused by monkeypox virus, and it's ravaging communities in the Niger Delta. There are a series of confirmed cases, even in Akwa Ibom State, across the Niger Delta, and that's why there's this intervention that's ongoing. We are rolling out the vaccines in the Niger Delta. Most of the states in the Niger Delta are concurrently having this campaign, though it is not a mass campaign. It is targeted at those who are critical, who really needs this vaccine to protect themselves of this monkeypox infection in our communities.
So who are those that are really critical and really need these vaccines since it's targeted?
Yeah, there are people who have close contact with infected persons with monkeypox infection, as well as people who have chronic illnesses like diabetes, heart diseases, and then hypertension. There are also people who have low immunity, living with low immunity, such as the persons living with HIV and AIDS, the people with prolonged use of steroids. These are persons who have been, as well as healthcare workers who care for these patients at the various disease infectious hospitals, and people in the lab who are exposed, who handle the samples from these patients and get the samples tested to confirm if they are really Mpox. So these are people we have targeted, that are targeted for this vaccination this time around. Thank you.
Oh, all right, so doctor, when we talk about the statistics of how deep into the communities of the Niger Delta the Mpox scourge has gone, could you bring us up to speed with that? And do people really know? Are people really aware of the importance of this health emergency and why they should take it serious? How far has the message of Mpox gone in the Niger Delta communities?
Well, it's still very sketchy. People are not really aware. They take it to be something unserious, but that's why we are here to create this awareness that the people in Niger Delta, they should take it very important. It's a public health importance that we handle this and try to limit the outbreaks of this Mpox disease in our community. Thank you.
How does someone know whether he or she has contacted the virus, and how does it spread?
Okay, the symptoms, the signs and symptoms of Mpox are usually classical. It begins with it could begin with a rash that's probably raised bumps, and that could quickly fill up with fluid, and then those fluid could become pulsy, and then it erupts and probably heals with a scar. These rashes could last for 2 to 4 weeks. It has a course of 2 to 4 weeks, and symptoms like fever, backache, muscle ache, and low energy generally are these are signs and symptoms that one could easily realize that he or she is having Mpox.
So how does it spread?
Well, it spreads. There are ways, several ways of transmission of Mpox. Mainly close contacts, human person-to-person transmission, where we have one who has close contact with confirmed cases may be likely to have this infection. Close contact such as skin to skin, mouth to skin, and then mouth to mouth contact, even sexual contact with person that has this infection. One is liable to come down with infection. Other routes of transmission could be animal to humans. Wild animals in area environment that wild animals have this Mpox infection. Persons who get close contact to these animals could get infected. And the last way of is the environmental transmission, where the virus sustains itself in surfaces and objects. And when one gets in contact with this contaminated surfaces and objects, and then pricks the eyes, the nose, and the mouth, it could be infected with Mpox could come down with it.
All right, Doctor.
Thank you.
Well, the misconception about the origin of Mpox is one that also needs some clarity. Remember that it started as the name Monkeypox.
Monkeypox. Yeah.
So I'd like you to bring some clarity as regards that origin. Is it that it originated from monkeys, or why was that name given, and why was it changed to Mpox?
Well, I think history has it that it was first discovered amongst the monkeys far off East Africa, where they have a very virulent type of the virus ravaging in East Africa. In the West African region, we have a less virulent type of the virus in our community. That's why the spread is not really something we need to worry about. It's a public health concern. The name Mpox, the stigmatization around the black populace, where you could say a man is a black man is a monkey. It's a way we needed to modernize it so that it doesn't have
any connotations of stigmatization. Oh, right.
So that's why it's now Mpox.
Is it possible for someone who has been infected, recovered, to be infected again?
Yeah, it's quite possible. Infection does not confer active immunity; it confers a partial immunity. So it's usually advised that one could come down with the infection, but it may not be the severe type. It may be a less severe type of infection. So such persons who have had it before, we should also advise them to have the vaccines, now that the vaccines are
all right. Well, Doctor, the Nigeria Center for Disease Control in recent months actually confirmed a lot of cases of Mpox. And when we look at the Niger Delta region, do you think the region is at higher risk of the Mpox scourge, maybe considering the population density, the market structure, or generally what goes on within the activities that go on within the Niger Delta region? How susceptible is the region to the Mpox scourge?
Yeah, thank you for the question. I think most of the recent confirmed cases are within the Niger Delta region. And I'm sure probably the vegetation of the area could also play a major role, where we have more of the mangrove forests and the wild animals in it, and the contact of hunters with these wild animals could be somehow responsible why we have more of the confirmed cases of Mpox in the Niger Delta region.
All right, doctor. If one discovers that he or she, or is feeling symptoms of this monkeypox, what's the next step? What should the person do?
Well, it's advised such a person should seek medical advice and probably quickly isolate his or herself, and then most of this condition could just wean out after 2-4 weeks. And the most important thing is to isolate so that it doesn't come in contact, doesn't spread this infection to others in the community.
Okay, apart from isolation in your place, is there any other isolation center where they can call the number and reach out to?
Well, yeah, Akwa Ibom State, we want to thank the government of Akwa Ibom State. There's this isolation centers that are the infectious disease hospital in Ikotepene, as well as the isolation center in Itumbang. These are places that the government have made available for treatment of severe forms of this infectious disease that needs hospitalization.
All right. Well, the WHO survey shows that misinformation and stigma major obstacles to tackling infectious diseases. For instance, the Mpox that we are discussing today. How much of awareness have the communities of the Niger Delta been exposed to? For instance, you're talking about the vaccination that is ongoing. I think this is the 5th day.
Yeah, the states were on the 5th day.
Supposed to go for 10 days.
10 days.
Now, if you were to rate the level of turnover, the turn-up of people or the communities that come in for this vaccination, are you impressed? Or you still think that there is much work that needs to go into creation of awareness and engagement of community stakeholders who are supposed to carry this information to their different communities to spread the word and get people to really know how urgent this health incident is?
In terms of awareness creation, where we are is not where we ought to be. There's still some gaps that needs to be filled. More awareness and creation, communication, advocacy to community leaders should be made. But right now, as the vaccination is ongoing, the turnout is encouraging. People have come out people have accepted this vaccine, and they've come out in their numbers to receive this vaccine at the designated centers and health posts that we are administering these vaccines in the state.
All right, doctors. Are there fears that you might want to assuage in regards to the vaccination?
Well, I always want to say that Mpox vaccine, they are safe, they are effective, and they are free. So everyone should come up if you are eligible. Eligibility to by age is 18 years. This vaccines that have been rolled out is just for adults, people 18 years and above. Once you meet the criteria, you ought to be line listed by the mobilizer. There are numbers that have been shared and some contacts made that we in the state, Kwara State particularly, should reach out and get line listed and then be engaged before the vaccines are administered.
Well, given that early detection seems to be key when it comes to tackling this Mpox scourge, do you think that if you were to access the Niger Delta region, I'm sure you must have been getting feelers from different states of the Niger Delta. How prepared are the health facilities of the Niger Delta towards ensuring that it combats these issues, especially when they get to achieve that early detection? Do we have the wherewithal to be able to tackle Mpox effectively?
Well, it's a work in progress. I wouldn't say that our health facilities are up and optimal, but work is ongoing to improve our state service delivery in most of our health facilities in the Niger Delta region. Our government across the region are creating impact in the health sector, and I think they still continue to improve on this as we progress.
All right. There are still a lot of lessons that the country generally learned and took away from the COVID-19 outbreak. Since that outbreak, do you think that specific lessons have been learned when we talk about, health interventions in other areas, for instance, the Mpox now that we are discussing? What vital lessons, what takeaways stood out for, health personnel, health facilities, and have we been able to make some very important progress when we talk about health emergencies in the Niger Delta region across the country?
Yes, I think what we took out from the COVID-19 pandemic was that surveillance ought to have been increased, and across the region, the surveillance for these disease conditions are on the rise. WHO partners are pushing in people to the community to source, to scout for survey, and then for disease conditions in the community. So surveillance system has really improved in quickly detecting these disease conditions in our communities across the Niger Delta.
Well, being on ground and having all the information at your disposal, so you've done a lot of research, and if you were to be called upon, you would have specific perspectives that you would want to share for governments of the region towards ensuring that they bolster the health sector and ensure that they are able to take care of their citizens more. If you were to make specific recommendations regarding steps that can be taken towards ensuring that this scourge is tackled more effectively than it is right now, what would those specific recommendations be?
Well, I think the most important is the political will. Budget to the health sector needs to be improved upon. Budget to the health sector in Nigeria and various states ought to be 15% of the budget. So if monies are pushed in as was agreed upon, a whole lot of improvement will be seen in the health sector across the Niger Delta and across the country. So I want to advocate for increase in budgetary allocation to the health sector, and as well as the monitoring and of the implementation of those aligned activities within the health sector throughout the year for us to have accountability and then the best out of the health sector. Our people deserve the best health care, and so government and partners should be up and doing to afford the people of the Niger Delta the very best they should have.
Well, lastly, as we let you go, I'd like you to importantly pinpoint some of those relevant steps you think the people also have. What roles do the people have to play in all of this? Because, I mean, without carrying the people along and them contributing their quota towards ensuring that the efforts at tackling Mpox are achieved, would still be having ourselves running in circles. What is the role of the people in all of this?
I think the role of the people are also very important because community engagement is paramount. People should take ownership of these health programs. Facilities built and maintained in communities should be protected by the people. We do not want people to vandalize hospital equipment, hospital buildings across the Niger Delta. These are where people who need help, who seek medical attention, can comfortably walk in and access the healthcare, quality healthcare in the Niger Delta. So that should be adhered by the people. Ownership of these programs and facilities by the people.
State Immunization Officer, Kwara State Primary Healthcare Development Agency, Dr. David Umoh, thank you very much for speaking with us, Niger Delta Today, and bringing some clarity to the Mpox fight. Thank you.
Thank you. On a parting note, I want to tell the people of the Niger Delta we should prepare for the big one, the measles rubella vaccine introduction that's coming in Nigeria and into the region by January, February next year. We need to create awareness. We need to accept these vaccines in our communities to serve our people. Children from 9 months to 14 years are the cohort that will receive the measles rubella vaccine next year. Thank you so much.
Thank you, Dr. Umoh.